Well, good evening, everyone. No matter how many times I do this, it still doesn't quite seem. I can't put words, into describing how it is just to see this empty room of not very many folks here. But I guess this is the new normal for a while. But I do appreciate those of you who are here for being here. As you know, the governor's phased reopening begins tomorrow across Texas. And according to state law, the governor's decisions with respect to this type of emergency is final. Monday morning quarterbacking either way at this point won't do any good. I'm almost 45 years old now, and I realize sometimes that some of the phrases I use maybe date me somewhat. Monday morning quarterback, and what I mean by that is I guess there was a time when we only had football really on Sundays in this country. We didn't have it every single day of the week. So what I mean is waiting until after a decision is made to criticize it. I'm not going to engage in any criticism of the governor's decision at this point because it's a decision that's been made. My job now as the mayor of Dallas and under state law as the governor's designated agent at the local level is to ensure that the governor's plan is successful. That's my job. And in this case, success or being successful means saving lives and restoring livelihoods. So today, I wanted to meet with you all, those who are here and those who are listening. I wanted to take some time to catch you all up, since it's been a while since we talked, about some of the things that the city is going to be doing in light of the governor's announcement about how he's going to reopen our economy starting tomorrow. So the first thing I'll address is what city services that we plan to open and what we are not planning to open. And then I'm going to talk a little bit about our economic recovery plans. As some of you may have heard already, our Parks Department plans to reopen our public golf courses, the Elm Fork Shooting Range, and our tennis centers. Our Park and Recreation Director, John Jenkins, is here today. Thank you for being here, John. And he's going to talk a little bit more about the details and the guidelines surrounding those reopenings in a few moments. I know that John believes that these activities are activities that our residents can engage in safely, and they are activities that fit under the guidelines that the governor has laid out with respect to our reopening. We're also considering plans right now to reopen the Dallas Zoo and the Dallas Arboretum, and under what conditions we can do so. I want to be clear. I want to make sure I say that again. We're considering plans. We are not announcing today that we are reopening the Dallas Zoo or the Dallas Arboretum. We are considering plans to reopen the Dallas Zoo and the Dallas Arboretum. Libraries are also allowed to open on a limited basis under the governor's plan starting tomorrow. But the city of Dallas will not be ready to reopen our libraries tomorrow. We're going to work very hard to get to a point where we can reopen our libraries safely. And I want to repeat that. We are going to reopen them safely. Our city staff is right now assessing options to phase in and restore library services as quickly and safely as possible. I want to re-emphasize that throughout this crisis, Many of our library services have been available this entire time to our residents. Those include access to ebooks, book discussions, story times, and adult learning opportunities. And we've also continued to offer library card signups and access to librarians, in fact, to answer any questions that patrons might have over the phone or through email throughout this entire COVID-19 outbreak. I'm very proud of our library system for continuing to function in this way throughout this entire ordeal. We value our Dallas Public Library system, which is an indispensable part of our neighborhoods and our communities. We also, unfortunately, have to consider the budgetary implications of reopening our city operations. We're experiencing right now a very significant shortfall in sales tax revenue this fiscal year and projected for the next fiscal year. We will have to make some very difficult decisions if we don't receive more resources, and with those resources, more flexibility in how we can use those resources from the federal government. But I am personally committed to preserving as many of our city services as I possibly can that our residents expect. With that, I want to move on to economic recovery. This is a subject that I've thought about since the day we canceled the St. Patrick's Day Parade back in mid-March, which seems like forever ago. We knew then we were about to face major economic implications from this virus, and as the restrictions increased from the cancellation of that parade in the days that followed, so did the importance of making sure that we had a robust economic recovery plan for our city. So a couple of weeks ago, I asked Richard Fisher, the former president and CEO of the Dallas Federal Reserve Bank, to lead a task force focused on economic recovery. He agreed, and he's now serving as the chairman. He spent the last couple of weeks advising the governor as part of the governor's strike team and collecting and analyzing local economic data. Yesterday, Ambassador Fisher informed me that he'd selected Fred Perpall, the CEO of the Beck Group, to serve as his co-chair to help lead our local efforts. And I believe that that is a great decision on his part. Very excited about what Fred is going to bring to this group. Fred's an incredibly talented businessman, and I think he'll make a perfect complement to Ambassador Fisher. Fred has already identified focus areas and will continue to work with partners such as the Dallas Regional Chamber to execute this economic recovery plan. I expect to hear more announcements in the coming days and weeks as Ambassador Fisher and Mr. Perpall begin putting together a comprehensive plan to help us rebuild our Dallas economy. And while I initially believed it would be a good idea to serve personally, myself and my two ad hoc committee chairmen, Adam Magoo and Casey Thomas, as part of the task force, upon further reflection and discussion, Ambassador Fisher and I agreed that a different structure would actually work better for everyone and ensure the most efficient operation of the task force. So, Chairman Thomas and Chairman Magoo and myself will not actually be members of the task force, although we will be in contact with Ambassador Fisher and Mr. Perpall as they continue their work. So this is going to be a purely private sector-led effort, and I've asked them to advise us on the best ways to move Dallas's economy forward. I believe that we have to unleash our local experts to do the work that they know how to do. They are uniquely qualified for this work. Our city's economy is crucial to the region, to the state, and to the country. Just 2 months ago, this city was thriving and attracting corporate relocations and expansions. And we will rise again, but it's going to take all of us working together. Finally, as I've said, we must continue to emphasize testing. Since this pandemic started, I've been pushing for more testing, and I've required through one of my early orders the release of testing data by all labs in the city of Dallas, public or private, so that we would know where we stood with respect to testing. We jumped at the opportunity when it was presented to us to host 2 federal community-based testing sites, the drive-through testing sites that you've heard so much about by now. And I personally advocated with our federal partners for the Walgreens drive-through testing location to be located in South Dallas, and that opened last week. I've been in touch lately with some of our private sector partners about bringing even more testing to Dallas, and I'm hopeful that we'll have more announcements next week and in the weeks ahead about that. So while we've made great strides in testing from where we started in early March, we've still only tested about 1% of the population of Dallas County, and that is, simply put, inadequate. We have to continue to push for more testing and more tools for local governments to succeed. We, here at the city, are on the front lines of this pandemic, and we must be able to identify cases rapidly to keep people from spreading the virus. We know we will have continued spread of COVID-19 in the weeks ahead. I want to be very, very clear about this. I realize that today's numbers, in fact, 179 new cases in the county and 5 more new deaths, were very, very difficult and disappointing to see. But as we begin this new phase of reopening tomorrow, I want the people of Dallas to know that their health and safety is and will remain our top priority. If you choose to go out, continue, please, to be responsible and to be safe. You should wear masks, as the CDC recommends, because, my friends, we're not out of the woods yet. Our city's strength has always been and always will be our people. We saw it after the October tornado, after the July 7th ambush, after Ebola, and after every single challenge this city has faced since long before any of us in this room were even born. And we need you now more than ever to help us slow the spread of COVID-19. We will get through this, that's for sure, but we cannot let down our guard. Thank you all again for being here, and I'm now going to turn it over to John Jenkins, our distinguished park director. John?
All right, thank you, Mayor Johnson. I just want to provide some brief updates as it relates to the opening of the golf courses and tennis centers and Elm Fork gun range. As the mayor mentioned earlier, the City of Dallas golf courses, tennis centers, Elm Fork gun range will resume public operations with specific facility and usage restrictions on beginning May the 1st. Dallas Park and Recreation phased approach to reopening select recreational facilities to the public extends also to our tennis courts located throughout our park system as well. Facilities and outdoor programs set to reopen will adhere to strict physical distancing as well as safe, sanitary protocols and specific usage restrictions, which include but are not limited to the following. Golf courses allow only one golfer per cart. Restrict tee time reservations to online or by phone only, no walk-ups. Restrict tee times to group sizes, no more than 4. Restrict access to the pro shops and to the pro staff only, and no more than 4 customers at a time. Golf pros will clean and sanitize carts after each rental and before being checked out. This is just a few of the 30-plus restrictions for our golf operations. As it relates to our tennis centers, the same restrictions with the exception of the golf cart rentals and Elm Fork Gun Range, open only every other shooting lane for rental, remove group seating areas, and last, I just want to remind to everyone that we will continue to take all necessary steps to ensure the public safety while accommodating our customers' preferences to play outdoor sports. Specific operating restrictions for these areas may be found on dallasparks.org. Thank you, Mayor.
Thank you, John.
All right, we'll open it up for questions. Yes.
You mentioned the task force for the economic recovery. They're working on specific areas. Could you give more details on what that plan as of right now looks like?
The question is, just because I'm not sure that this is all mic'd, more details on the Economic Recovery Task Force, right? Yeah, go ahead.
I'm just going to leave this mask on, so I hope you can hear me through it. I'm going to try my best to speak as clearly as I can. The Economic Recovery Task Force that's being chaired by Richard Fisher is being driven by the private sector, like I said. At this point, they are still collecting data on our local economy and trying to figure out, based on the data, what is the best way to proceed. They are very committed, and we've talked about this, they're very committed to making sure that we don't assume anything about the impact that this virus has had on the economy, but to actually let the data tell us where the impacts have been felt the most, and let the data tell us who the most vulnerable have been and who's been impacted the most, and then decide based on that where to focus and who that they should consult with and have at the table as part of that discussion. Some things that we can assume, but again, I've stepped away from being on the task force because I really do want this to be driven by the folks who know best, which are the folks who are in the economy every single day making Dallas the great city that it is. But some of the assumptions that we can make are that the smaller the business, the more vulnerable it is. So our small businesses we're particularly concerned about. Our historically underutilized businesses we are concerned about. The businesses that have catered to and have been historically aimed at minority communities, lower income communities. Some of the types of businesses, frankly, that our city's small business continuity fund that we passed last week at the city council were aimed at. The smaller size businesses that have more of a focus or have a workforce that's more of a lower to mid-income workforce. So they are particularly sensitive to that, but again, they want to make sure that they are not running down a path based on assumptions. They want to make sure that it's all based on data, so they're still in the data collection mode. They also wanted to make sure that we knew what the governor was going to be announcing, which is why it was so beneficial to have Ambassador Fisher be the task force chair, because he's also on the governor's strike force. So we now know that tomorrow's the day that the opening begins. And so we wanted to make sure we knew that, and now the task force is, in essence, is off and running. So that's all I can tell you at this point.
So the question is, how will the city enforce the governor's occupancy limits? I think this, just for preface here, at the ad hoc committee on human and social, or COVID-19 human and social recovery, our assistant city manager was talking a little bit about that, and there's an emphasis on voluntary compliance, but I'll let the mayor take it and very impressively answer with his mask on.
I'm doing the best I can. This is all so surreal still, this, like I said, this room. All right, so what was the question again? That threw me off.
How will we enforce?
Enforcement is left up to the private businesses according to the order, according to the executive order. However, I can say this in terms of priorities that I have, that I think things are important for the city to keep in mind when we are acting as the governor's agent on the local level, which is what state law says. State law says that the mayors and county judges have the authority and are to act as the governor's agent at the local level to help enforce any emergency orders during an emergency, which is the situation we're in. So my priorities are this for enforcement. I want us to make sure that we are being a good partner to the governor and to the state and making sure that we help our private businesses comply with the order, but doing so in a way, of course, that prioritizes the safety of our residents. You know, we're trying to balance honoring the governor's wishes to open the economy, but we want to make sure we keep our people safe. So we are going to be as helpful as we can. But something else that's very important to me is I want to make sure that we are being mindful at every point as the city of Dallas of the costs associated with enforcement and making sure that we are getting the assistance that we need to help with that enforcement. So it's important to me that we continue, and I have been constantly talking to Washington, D.C. and to Austin to make sure that we have the resources that we need to help us with these compliance with these orders and things, because it is not a zero-cost endeavor to go out and send code compliance officers to these sites or to have the Dallas Police Department involved to the degree that they're involved with any of this enforcement. So it is personally important to me as the mayor of Dallas, as the person who is elected by the entire city to represent their interests, to make sure that we are being a good partner, we're doing our job under state law, that we're being a good partner to the county and everyone else that is involved with public health, but we have to protect our financial interests as well. We have to look out for the taxpayers of Dallas, and so I want to make sure that we are getting the help that we need from Washington, from Austin, from the county, from wherever, to make sure that the city of Dallas isn't footing the bill alone for enforcing these orders and that we get the help we need. Yes. I am. I'm talking about money.
Mayor, tomorrow is May 1st. That's Veterans Day. A lot of people are waiting for these forms online for the Veterans Assistance Program. When are they going to be available, and also what are the requirements, or will the undocumented community be able to receive this help as well?
Okay, so the question was, when are the applications available online for the mortgage and rental assistance program? And you also mentioned undocumented residents. Will they be able to be part of that? You know, those will be available online on May 4th. We'll be pushing out information about that in terms of the actual requirements. I don't want to misspeak and tell you anything that that is incorrect, but we'll get that to you if you want to follow up with me afterward. There's a lot of bullet points there, so I don't want to say anything that's incorrect and give people the wrong information, but we'll get that to you.
I also wanted to ask about the numbers. You brought them up. They are the highest that we've seen in terms of new cases, and you had commented over social media that you felt like the number of hospital beds and the number of ventilators needed probably weren't of an accurate reflection. Those have also increased, though. Do you feel like we are reopening in the midst of our peak? Because end-phase opening may has been sort of a general idea. We're doing that something where told it to be likely to peak in the number of cases. Do you feel like we're opening just as we're getting?
The question is, do we feel like we're opening just as we're beginning to peak, that we're doing a reopening?
I think that's a really great question. I think it's a really smart question. I'm going to do my best to answer that as succinctly as I can through this mask. So here's what I think. I think different models predict different things about when we're going to peak and whether and how big the peak is going to be when it occurs. So I'm in no better position than certainly someone who's a trained medical doctor or epidemiologist or whatever to tell you which one of those models you should believe is when we're going to peak. Is it the end of this month? Is it the middle of next month? I'm not in a better position than any of those folks to tell you that. I don't know. Today's numbers are not great news. We don't love to see a new record high number of positive cases, but we don't really know yet whether or not we are in the middle of the peak now, or if it's coming in a few days or coming in a few weeks. We just don't. And I don't want to give anybody the false impression that we do. But I will speak to something that you asked about in terms of what information I think is really important for people to know. I've ordered the information be reported to me that I think is most important for the public to see. Two things. I've ordered information about all the testing that's being done in the city, and I've ordered all the hospitals in the city to report what their hospital bed capacity is, their ICU bed capacity, and their ventilator capacity. And the reason why I've said at this point, having watched this for a while, I think that second report may be just as important, if not more important than the first report, is this. When it comes to the testing, because of how haphazard it was done early on and how little of it was done, and how we still are doing testing in a way that I would not describe as a robust framework for testing, meaning who can get tested has been evolving and changing over time, and the availability of testing has changed over time. So we don't really have a way of comparing truly where we were a week or two ago to today in terms of how many people are testing positive, because we weren't testing everybody. We really don't know that. But here's something that we absolutely can know for a fact. We can know for a fact how many people are being hospitalized in our city's hospitals and how much space we have to accommodate more people who might need hospitalization in the future. And as you see that availability of beds or ventilators going down, that is the extent to which you should become more concerned and the extent to which you could say that we are seeing some type of surge. So my focus has been like every single day watching that percentage of beds that are being utilized and ventilators that are being utilized, because I want to know how close we are to getting to that point where we can accommodate people who are getting sick in our hospitals. And we are starting to see a slight uptick where we are hitting the high 60% range on our ICU beds right now, and that's giving me some concern. And I'm saying that is probably the most real data that we have to look at to see what's really happening out there. Flattening the curve was always about making sure that we never had more cases at any time than we had hospital beds and ventilators to accommodate. So our goal needs to be, and success will be defined as, making sure we never reach a point where we have more people who need hospitalization than can actually be hospitalized. So that's what I've been trying to get people to focus on.
All right, we have time for one more if anyone has any others. Otherwise, we'll move along. All right, that works. Well, thank you all very much for coming, and let me know if you have any follow-up questions.
Thank you, guys.